Right, good morning everybody. Let's get started. So, for those of you that have not joined one of our webinars before, my name is Michael Watson. I'm a Mental Health Improvement Advisor in the Mental Health Intensive Support team. I've been working in the team for 7 years now, doing a variety of improvement work up and down the country. Prior to that, I spent 4 to 5 years working in the physical health equivalent, IST, covering elective care, RTT and cancer. And before that, I worked in a number of operational management roles in acute trusts. So we're here today as part of our programme of support for elective recovery, and we're here to look at improving care with pathway maps. So as you can see on the slide here, all the slides, the recording and the tools and the other materials discussed today are also hosted on our Futures site. Obviously the recording isn't hosted yet because we haven't made it, but it will be as of later today or tomorrow. Furthermore, the recording will also be made available on our YouTube page. The version that goes on our YouTube page, because it's open to the world and his wife rather than just people who work within the NHS, we will remove the Q&A section at the end of the recording. So it'll just be the content from the slides. That'll be available on our YouTube site, along with the other recordings, which you should be able to access through the link in the chat. Next slide, please. So, welcome. As I said, we're here to talk about pathway maps. We're introducing our resources in terms of improving care with pathway maps. As I said, those resources are also on our Futures site. We want this to be as interactive as possible, so there'll be time for a Q&A discussion towards the end of the session. And as those of you that have joined previous sessions will be familiar these days, we're using the Menti system to try to get your feedback as we go through the presentation. We've also got a Q&A bit in terms of chat, so if you place your questions in the Q&A, then we'll address those as we're going along if they're particularly pertinent, or we can save those up for the Q&A section towards the end of the presentation, where my colleagues will be collating the questions and ready to put those to the presenters at the end. In the spirit of improvement methodology, we keep kind of refining and updating all of our stuff on the Futures site as we're going along, as we're getting feedback through these webinars, and as we're getting feedback from systems providers and commissioners as we're trying to deploy the resources to you on the ground. So do keep checking back to the Futures site, because we do keep updating it. And please do keep engaging with us. Tell us your ideas for changes and improvements and corrections. You can do that through the chat on our Futures site, or you can do that through the feedback form, which we would encourage you to complete, which we'll give you details about at the end of the session. So at the end of our last session, we had a reasonable number of feedback forms completed, which was much appreciated. Thank you. Apart from general positive vibes, there wasn't much in terms of very specific feedback, which is absolutely fine. All we did have is that the pinging noise at the beginning of the presentation when people were coming into the presentation was very annoying. I completely agree. It was very annoying for me as well as a presenter. So as far as I'm aware, we have turned the pings off. I certainly haven't heard any. So there you go. We responded with alacrity to your feedback. Second bit of feedback was that there's quite a lot of background noise, primarily from me. I can only apologise from me and from my plumber Jacek. I certainly made sure that there's no background noise happening this time, and hopefully you can hear me loud and clear with no banging and no pinging. So we will respond to your feedback when we get it. So please do make sure that you use the feedback form, and we will do our best to respond and to improve, because that's the kind of spirit in which we want to embrace this, and we would encourage you all to embrace your own improvement work. Anyway, without further ado, what are we talking about today? We're talking about pathway mapping. So we're here today to try to help you to understand the purpose of care pathway maps, and frankly, probably to understand what a care pathway map is and what it is not. We'll give you some tips on how you can develop your own pathway maps and how you can apply them to your services and to your systems. We're going to talk about how you can use data to understand your pathways and to identify improvement opportunities. We're going to give you a few examples of what some pathway maps might look like at different levels, some tools and some more resources we can link to. And then also, as those of you that have joined previous sessions will probably be familiar with, we'll talk about how we can help you to implement some of the things we're going to talk about today, and there'll be the Q&A opportunity, as I said previously, to ask questions of the team. So please do pile your questions into the Q&A, and we will respond to the most appropriate team member towards the end. Next slide, please. So who are we? So from the feedback we've received, we do know that still, although a number of people are attending all of our webinars, well done, gold star, there always seem to be around at least a third of people who are new to the team and new to our webinars. So we are the mental health intensive support team. We're a small expert quality improvement team, part of NHS England. We work nationally, but we provide support locally to systems and providers to try to help to improve population health, quality of care, and value for money in mental health care and learning disability and autism, I should add. Within the team, we've got a range of experience. We've got senior experience of operational delivery, of clinical roles, of analyst and process management roles. So we've got a mixture of different competencies and skills across the team, all working at a senior level in numerous organisations. Those of us who have a professional registration, which I should add is not me, also have a lot of experience acting as an expert clinical resource. As I said, we come from a range of backgrounds and specialisms, and we deploy these, plus our experience of working across mental health providers over the last 6-7 years since the team existed, to try to help you to try to deliver better care for your patients. Next slide, please. And so finally, this is part of the our programme of support for mental health elective recovery. So just to clarify, so elective care is a very commonly used term in physical health care. It might be less familiar to those of us working in mental health care. Elective care just means non-urgent care, effectively. So things for which you have an appointment, things which are scheduled. That's what we mean by elective recovery. So the impact of COVID, plus historically well-developed waiting lists in mental health, means that there is a increasingly urgent need to try to deliver as much as effectively as we can with the resources that we have got. So we've developed the programme of support for mental health elective recovery in order to try to help you to make the most of the resources and the people and the architecture that you've got to deliver improved services around quality, experience and outcomes to your service users through improving access, waiting times, utilisation of resources and implementing best practice. We've developed this based on our own personal and professional experience and our team's collective experience of 6 or 7 years of diagnostic reviews across a range of mental health provision, including early intervention psychosis, children and people's mental health, adult IAPT and so on. And some of you on the meeting may have experienced the work of our team over the years. We've also borrowed some of the established methodologies from our colleagues in the elective care physical health intensive support team, where they're also rolling out a significant elective care recovery programme, which runs in parallel to this. Next slide, please. And so finally, just to give you an overview of the rest of the programme. So as I mentioned, this is our pathway mapping module. You've already had the sustainable waiting list and backlogs modules. You've had the optimising capacity module, and you've had the introduction webinar, which was right at the beginning. So this is our 4th webinar in the eventual series of 8. And we encourage you to take part in all of them. And as I mentioned before, all of the resources are available on our Futures site, and the link is there in the slides. And when you get circulated the slides, then that link will be clickable on the PDF if you need help to access the site. So without further ado, I'll hand over to my colleague, Louise.
So good morning, everyone. I'm Louise Thomas. I'm an improvement advisor within the mental health intensive support team, and I joined the team in August of this year. My background is I spent 6 years as a clinical network programme manager over in the northwest of England, supporting service change and improvement. And prior to joining the NHS, I spent 15 years working for local authority. So this is the first part of our Menti. So if you haven't already, the instructions for joining the Menti are on the screen. You can either use your your camera and pick off the QR code, or go onto the Menti website and enter the code 19127996. So the first question for you is, do you use pathway maps within your services? So I will give you a couple of minutes, 30 seconds to answer that to see. So we're getting a good response come in there. 33 are responding with a yes. 18 are not sure. Okay, so I think predominantly most of you do use a pathway map within your service, which is great. But we are having some that are unsure. So hopefully by the end of this webinar, you will have a really good understanding of pathway maps and how they can be used within your services locally. So I'm going to move on to the next question. I think we've finished with that one. So I'm going to move on to the next question. How confident are you that you can develop or update pathway maps in your system? I'm going to put a little countdown on that one. Lots of people answering. So we've got fairly confident, split between slightly confident, not confident, fairly confident. Okay. So again, hopefully at the end of this webinar that you will have a bit more confidence, and obviously reach out to us if you do need that additional support. So why do we need pathway mapping? So really, if you have well documented pathways, it really supports building a foundation, and it's a springboard for improvement across a number of different aspects of care delivery. And throughout this presentation, we're going to pick up along these points of how it will support you with this. So it will support around the assessment of service that's offered, improvements for patient experience, delivery of the evidence-based practice, support that timeliness of care, which is really important to support patients' recovery. You can look at it as workforce development. What are the key workforce and staffing structures that you need within that pathway? Look at thinking of MDTs. How can you have different roles that will support the flow? And then also looking at what are the key data components that you need to capture to support that flow through that pathway. So on the screen, you can see a couple of quotes around the benefits of pathway mapping. So obviously, a care pathway can be defined as a tool which is used to manage the quality in healthcare concerned with the standardisation of care processes. Care pathways seek to promote organised and efficient client care, which is built upon evidence-based practice. Evidence shows that the implementation of care pathways significantly reduces the variability in clinical practice and improves outcomes. So within this slide, which you will get out after the webinar, you can see some links to other sites that will support you with this work as well. So what do we mean by a care pathway map? So a care pathway is both a tool and a concept that embeds guidelines, protocols, and locally agreed evidence-based and patient-centred best practice into everyday use for the patient. A care pathway map is a visual representation of a care pathway, and it's typically in the form of a one-page flowchart diagram. And a little bit later on, we're going to give you some examples of different levels of care pathway maps that are sort of tailored for different audiences. So within them, they clearly describe the different elements of care and services and teams that are involved within that care pathway. And this is a visual sort of representation for health professionals and also, most importantly, for patients. A clinical pathway is a type of care pathway, but a care pathway may include non-clinical components. It is not the same as process mapping. So the identification of the different activities undertaken by staff and patients in the course of delivering care used to identify areas of duplication and error waste in a system. In any care setting, care pathways exist in reality, whether or not you've actually got them documented in a visual guide and whether or not that they're widely understood. So to make sure that this is done properly, you need to have 9 key principles that underpin the development of your care pathways. So I'll just run you through them and we'll go in a little bit more depth in some of these areas. So you need to make sure that you've got pre-agreed waiting list management processes and booking rules within each of the care pathways. We need to make sure that you have access to that real-time accurate data to support that flow. And then you can look at any sort of backlogs, etc., if you do have that real-time accurate data. We need to make sure that each system service has efficient and patient-centric scheduling, and it can be used to maximise productivity and use of capacity within the service. In one of the previous webinars, the optimising capacity, we talked about the effectiveness of job planning and how that can support capacity and demand and modelling your services. So, that is a real key principle to support this work. We also need to make sure that you have systems that measure and monitor delivery of key performance indicators. And, this is about clearly and effectively communicating with our patients, whether that's by verbally showing them the pathway and providing it in a written format as well. Within pathways, you need to make sure that you have agreed pathway milestones. And then also it's about clinical decision making on an individual patient basis. So, as we said earlier, it's important around setting those local standards for pathway management. So, if you haven't got national standards, it's really important to establish local standards. And to do that, you must co-produce them with your local stakeholders. And some of the things that we need to be looking at are how long patients can be expected to wait to access the treatments. How are patients to be discharged from and transferred between different services, because all patients will be on different pathways for different services as part of their treatment. What's the estimated duration of treatment and criteria for discharge? How's that going to be formulated? And again, how's it agreed with the patients, documented, shared, measured on and reported on? And then how's clinical case management supervision to be delivered? What data are you using locally? What delay codes have you got? And how do you aggregate that? How do you performance manage that and respond and report on it within each of your teams, services and systems? And then how and when extended treatment reviews are to be delivered. So there's some of the sort of key areas of setting local standards that you need to consider when developing your pathway maps. I'm going to hand over to my colleague, Sean, now.
Hi, I'm Sean Griffiths. I'm a Mental Health Improvement Senior Manager within the team, and I've been with the team nearly 2 years, and my previous experience is in mental health nursing, working in a number of clinical and operational roles. The first, just to say, these are examples, but don't try and read all of the details, because you get quite bogged down. You won't be able to get through all of it. So they're just examples of how they're set out. The first example we've got here is an autism pathway map that maps out some of the process with the formulation, assessment, treatment, review and discharge stages, along with more detail around the different measures that are used along with the evidence base for the pathway. Next slide, please. This pathway map is a bit more visual. It shows a crisis pathway with the points of entry, points of exit, into the pathway, and how patients move between the different parts of the pathway. And next slide, please. This pathway maps across 2 slides, and this is a bit more detailed pathway map and a bit less visual. This one's for anxiety. It shows different stages of sessions that a patient may be at, along with the team members that may deliver an intervention at that stage. It also documents the core tasks or interventions, along with the intervention type and social factors. Then at the end, it's got the discharge preparation and planning stage. I'm handing over to my colleague Nick.
Good morning, my name is Nick Gitcham. I'm an improvement advisor with the team. I've been with the team for 6 years. Before that, I worked in physical healthcare, where I was involved in pathway mapping across stroke, kidney disease, and cancer pathways. So I'm going to run you through some of our tips for developing pathway maps. But before that, just building on from what Sean was saying and what Simon's posted in the chat, we are really keen to hear from you about the work you've done in this area and any pathway maps you've developed that you'd like to share. Please post those in the Q&A and we may come back to those later. Okay, next slide, please. So we're going to start with a Menti, and this is a question about how often, if those of you who do have pathway maps, how often you are reviewing or updating them. So let us know. Okay, so fairly infrequently, I think, is generally the consensus, less than once a year or never. A few people responding that they are regularly updating them. Okay, next slide, please. Now, which system partners have been involved with the development of your pathway maps? And you can select one or more of any of the different potential agencies who may be involved in pathways in your area. So fairly good level of involvement in primary care and service users. That's encouraging to see. And again, please share your experiences or any pathways you've developed that we can look at later. Great. Okay, next slide, please. So the overall approach for developing pathway maps, there are a number of key things we recommend. Firstly, obviously, they should be informed by commissioning priorities, but it should be an iterative process, and the pathways themselves should be informing commissioning in terms of any gaps in service provision or issues in delivery. And ultimately, they need to be both service level and system level. Ideally, you would be starting at a system level and mapping the whole pathway across multi-agency delivery partners, but it may be pragmatic just to start with your own service and map that and then join that up with the rest of the system partners who are involved in the delivery of care. But we think it's really important that it is developed collaboratively with all stakeholders, including patients, service users, and their families. And by actually talking through the map with staff and patients, you're going to be able to identify areas that do cause frustration or areas where things don't really work as they're intended to, which may not be what you expect to be delivering. And if a pathway map is complex, if you've got a complex area of delivery, which basically most community mental health services are, you're likely to require multiple maps to capture it in its entirety. But you should include a high-level overview. So you may have one top-level, system-level pathway map, which has for each box or element one of the services or teams, and then for each of those components, you've got their own pathway maps about how people move through those systems. And as Sean has shown, there's a variety of ways in which you can document pathway maps. We're not being prescriptive in terms of how they look, but it is important that they look understandable and they're fairly clear. So if the pathway map looks complex or confusing, then it probably is both to people who are meant to be understanding what the pathway map is showing and people who are navigating the services. Next slide, please. So you're probably going to need a variety of pathway maps for different audiences. So for people who work in the service and are delivering the services, you're going to have a highly detailed map, which includes potentially some jargon or technical language that people delivering the service understand. But when you're looking at how you're showing the pathways to referrers, GPs and schools, for example, you're going to need a different way of presenting the map, a clearer way, and certainly with more of a focus on things like the referral criteria. And then again, for service users, patients and family members and the public, you're going to need to obviously be careful with the language you're using and make sure you're stripping out any jargon or acronyms so it is clearly understandable. We find a very useful way of using pathway maps is to look at the information flows and how and where information is being captured. So you can look at the administrative pathways for patients as well as the clinical pathways, and consider how and when at each point in the pathway patients are being given information about the care they're going to receive, how and when they're asked to provide information to try to avoid repetition. And important components is how and when appointments are made and communicated with patients. Next slide, please. So, as I say, we're not being prescriptive about how you present pathway maps as long as there's a level of clarity and people can understand what they mean, but there are some things we think you should definitely be including. First and most important, obviously, is the key milestones and any decision points within a pathway, how and when care is planned and agreed and delivered. The referral routes and mechanisms, how people come into the system and flow through the system. It can be very useful, certainly for internal pathway maps, to include the indicative volumes of patients you're expecting at each stage, and that will help you use the pathway maps for minor capacity planning and workforce planning, which we'll come back to. And the waiting time standards for key milestones. So how long you expect people, or hope people are going to be waiting for assessment and to start treatment and to complete treatment within the pathway. And linked to that, details of any of the treatment offers, particularly with reference where applicable to relevant NICE guidance or quality standards. And the acceptance criteria, which is again linked to referral routes and mechanisms, and is particularly useful when you're using pathway maps with referrers for primary care and schools, for example. So, as I've said, they can be developed at different levels, but there should be an overarching end-to-end pathway map covering all the key touch points in the patient journey and all the teams and services involved. And best practice we would consider is also to use pathway maps to include details of the outcome measures that are used and how and when you're using the outcome measures within the pathway. The KPIs or details of how you're evaluating the pathway, which again we'll come back to later on. And some basic version control information. So as soon as you publish a document or a pathway in the form of a PDF or Word document on a website or intranet, there's the risk that it will become out of date and still be in circulation. So just include some basic details about how and when the document was created and when you expect it to be revised. Next slide, please. So some pitfalls to try to avoid. Well, firstly is the concept that pathway isn't a term that's really all that widely used or understood necessarily by the public. So think about the language you're using again when it's public-facing documentation. And it's important to include people with lived experience because they'll often tell you things about your pathway which you didn't consider or isn't intended in terms of how you're wanting to deliver care. And again, we'll come back to that in the section that Sean's going to talk through next. There is a potential tension between standardization and personalization of care. And by using pathway maps, we're not suggesting that people need to be put into a box and just given one particular component of care or a sort of track where they can't move between different components when their needs change. So there does need to be some level of flexibility and movement between different treatment offers and options, but you also want to ensure that your level of flexibility isn't excessive in terms of some level of standardization being important to run an efficient service. Also, obviously, many people will be on more than one pathway, either within mental health services or in physical health services as well. And just by having a a set of well-documented pathways, it can potentially give you some false assurance about the quality of care that's being delivered. You may have a very neat and clear pathway map for an individual service, but if patients on that pathway are also requiring other services and there's disjointedness between your pathway and other pathways, then they're not going to be getting the good care that they need in a holistic way. So you need to be thinking about how many people on your pathways do have other needs and how those needs are being met, and how are the linkages between different pathways joining up. And as I've mentioned, pathway maps do go out of date, so you need some sort of refresh cycle and a version control system. Okay, I'll now pass on to Sean.
Thank you, Nick. The next section that we're going to go through is using maps to drive improvement. Next slide, please. This firstly, we look at assessing the service offer. So, what are the questions that the process will help us answer? Firstly, do all parties have a shared understanding of the service offering across the system? So, and also, does the service offer meet population needs, health inequalities? It's really important that we understand what the needs of the population that we serve are, and any health inequalities that the community that we serve may be disproportionately affected by. Next, are there areas of duplicated activities such as assessments or opportunities to streamline the way services are delivered? This can also be an issue and result in patients feeling there may be a lack of communication across the different services within a provider. And also it can affect how credible or competent that a service looks if the patients are turning up and they're having the same questions asked. Where should we focus efforts to improve the service? Examples: to develop a demand and capacity model or undertake process mapping, something we'll talk about later on as well. What issues are preventing us from delivering the level of care we would want to? Are there areas of risk for patients in accessing treatment, e.g. undefined handovers? How can we best measure outcomes for patients at service and system level? And finally, how can we best measure the performance of the system? Next slide, please. Next, we'll look at improving patient experience. The pathway map should be used in these different areas. So, describe the service offer clearly to patients and receive feedback on the experience of accessing services. This is really, when we use pathway maps, we can use this, and it's quite essential that we can be this can be very valuable. And it's kind of a less formal way that we can get feedback on services. Explore how and where the offer is complex, frustrating for patients to navigate. This helps to structure discussions with patients about their experience, and as part of the tools here, we see as part of the experience-based design or experience-based co-design, to identify gaps in service provision and touch points. Next slide, please. It helps as well to ensure we have evidence-based practice. So pathway maps should describe all interventions offered during a period of treatment and will provide assurance that a comprehensive offer is in place. This is an area where we have seen in the past and we've seen as a team that there can be gaps. Some of interventions are not described when people map out a service, and because of this, patients can't fully understand where the care offer is and what interventions are available to them through the service. Pathways should describe the offer of all evidence-based interventions being made available. Should also look at pathways, should also describe the components of the wider aspects of the service offer. So care coordination, biopsychosocial interventions, for example. The clinical interventions offered by the service should be informed by best practice guidance and agreed in local clinical governance structures. Then it's essential that we have high-level clinical governance across this, and a clear line of sight is needed from senior management down to care delivery. Each intervention should be should specify the expected dose to be delivered. This should be expressed as a range of numbers of sessions. It should be informed by best practice guidance and include review points for determining that if treatment is complete at the lower end of the range or if additional treatment sessions are required. Next, we're going on to improving the timeliness of care. So pathway maps can help us here by the pathway maps will give us an opportunity to describe agreed standards for how care will be delivered. As it's been detailed in our previous webinar, understanding backlogs, it's important to understand waiting times and waiting time standards. So there might be local, nationally defined standards, and if we've got clear pathway maps, it can help us to understand that. And we can see here where there aren't national standards, it's important that we engage with patients and with staff, so we can look at what are acceptable waits at each stage of the pathway. Next, we look at including waiting time standards. Use data and tools such as Pathway Analyzer to develop a hierarchy of delays. Which do we need to tackle first? So we found these systems, that they don't always understand where the waits are and why they have waits. And Pathway Map can help us to understand these waits and how to address them. And lastly, use tools such as process mapping and demand capacity modelling to understand causes of delays within pathway stages. Next slide, please. Next, we're looking at reviewing workforce skill mix and capacity. And we've seen as a team over and over that there are gaps within the workforce, and we all know that the issues with recruiting workforce at the moment. But pathway maps can be used as the first stage of establishing where the gaps are within a service. The following two-stage process will enable you to describe what skills you need in what quantities to deliver pathways. The first step in the process, and where a pathway map could firstly be beneficial, is in establishing skills, competencies and qualifications that are required to deliver a service and the interventions that the service will offer. We look at the first step now, so about the planning for a pathway delivery should be based around the skills required for the professional roles. So pathway map should look at the pathway should describe any core qualifications required to deliver evidence-based treatment that's going to be offered within the service. So e.g. trauma focused CBT. Pathway should describe the core skills and competencies, experience on the job training to ensure fidelity to the pathway. This may include how to record outcomes, etc. And lastly, pathways should describe any pathway-specific supervision requirements. Next slide, please. So the next step we've got is around the capacity required. We also see that the systems and services do not clearly know what their capacity and demand is. There are resources and support available around this, and we're going to speak a bit about those later in the webinar. So we're trying to estimate the number of patients requiring treatment each part of a pathway, and we're using the pathway mapper to do this, combined with the defined treatment dose, and it will allow you to model the staff team capacity in treatment slots needed to deliver the number pathway. Adjustable by any stratification in delivery, so use trainees for example. This in turn will enable you to plan your recruitment, retention and training activities around delivering the capacity that is required. And finally, the pathway maps can be used to help you with improving data accuracy and flow. So when we're in this area, when we're looking at data accuracy, we look at the duplication, inefficiency, wastage and gaps in access can be identified by reviewing the pathway maps with staff and patients and asking the following questions. What information is captured at each stage and on what systems? Is key information captured and recorded just once, or is there multiple times where it's been recorded? Are patients asked to provide information that they have already provided before? And that goes back to when we said about duplication can create frustration. How are outcome measures captured? How are these shared between providers where more than one service is involved in care delivery? Are there elements of the mental health service data set that are poorly captured or reported? Do practitioners in different parts of the pathway have access to the data they need? What are the gaps? How effective and efficient are the systems used to capture data? And could these be streamlined or standardised? And lastly, would there be value in introducing or extending patient-held records? And just handing back to the colleague, Nick.
Thanks, Sean. So before we wrap up and move on to the Q&A and then to discuss some of the support that's available, I'm just going to run you through some, flag up to you some of the tools which can help you with this work. Firstly, is a preparation and self-assessment checklist, which we've got on our Future NHS site. In the navigation panel there, so where you can find it on the site. And basically this will just help you answer the questions: where should we start with pathway maps if you don't have them in your service or team, and how you should prioritize different pathway mapping activities. So it gives you a good indication of where to focus your efforts in what can be potentially a slightly daunting task or prospect. And the next tool we have, which Sean mentioned, is a pathway analyzer. So this is a tool for analyzing pathway data and better understanding performance, delays and variation within pathways. This is a tool developed by our colleagues in the elective care improvement support team, primarily for use in physical healthcare settings, and it's been widely used in particularly cancer pathways, but it should apply just as well to any community mental health pathway, because it allows you to define your own milestones within the tool, within the pathway. It can be flexibly used with any pathway of care, and it provides a very visual output which is accessible and impactful way of understanding and communicating insights. And we've got an example on the next slide. So you can use this tool, which is on the Future NHS site, or you could basically do the same thing in an Excel document. It's basically taking some basic pathway information and plotting it into a chart form, which we'll look at on the next slide, please. So this is an example from a fictitious IAP service, and the milestones that have been defined by the user is at the top of the chart. So you've got referrals being registered, sent for triage or screening being undertaken, assessment appointments being booked and then completed, and then treatment plans agreed, and a variety of different options for care. So guided self-help, step 2 interventions and step 3 interventions. So this is kept at a fairly high level, just the step 2 and step 3 as milestones in themselves, but equally you could break this down into individual pathways and therapies. But what you can see it's doing is giving you a very good indication that for this example, you've taken 30 pathways that have been completed, so patients who have been through the system and started treatment, what's happened to them, or you could just use the last 30 people discharged, which would include people who didn't actually start treatment. And it will give you some really useful and rich data about the level of variation, and we can see here that most people are completing their pathways within 90 or 100 days, but there are some very much longer outliers, and you can clearly see where there are big delays in some of the pathways, which is generally more understandable to people and relatable to people, rather than just tables of data and statistical variation data, which isn't quite so immediate in terms of its impact. So we've seen these being used really effectively, particularly in physical healthcare settings, and we think they'll apply equally to mental healthcare settings, and we can provide you with support in using these and potentially developing this tool further if it's found to be useful. Okay, so to wrap up, really, pathways are basically just a representation of how and when care is delivered, and they won't they'll only generate improvements in care delivery when they're used proactively to identify and respond to areas where there are issues. So you need to think about how you're evaluating the effectiveness of the pathways that you're delivering in terms of outcomes, routine outcome measures, for example, in terms of experience, both of patients and of staff, and in terms of timeliness of people accessing services where there are waits, and also efficiency in terms of things like missed slots and wasted appointment slots. So some of these measures are going to be best collected through routine reporting and probably will be being reported in monthly KPIs and dashboards. But you may also want to look at a regular audit program, quarterly or annually, to go into more detail in certain aspects of the pathways and consider how effective they are. But of course, ultimately, any measures must be useful to ensure that they're adding value, and there's always a trade-off between introducing new metrics and the burden of collection that they require and the interpretation. So getting that balance is really key, and very keen to hear from any of you of examples you've got of evaluating your pathways. But once you identify where there are potential improvement opportunities, you've got basically two options. And the first is to improve the existing pathway using standard quality improvement approaches, such as PDSA cycles. Or you may need to take a more fundamental approach to redesigning aspects of the pathway. But these two aren't mutually exclusive, and you're probably going to need to be doing both at various times during the course of an annual cycle. So, to sum up really, the pathways need to be developed by a group that is as multi-agency and multi-professional as the component parts, with input from patients, service users, families. But developing well-documented pathways does build a solid foundation and a springboard for improvement across all parts of care delivery, which Sean has gone into detail on. So firstly, the assessment of the service offering and the comprehensiveness of the offer, the patient experience, the fidelity to evidence-based practice, the timeliness of care, workforce development, and data capture and flow. And these underpinning elements are covered in many of our other webinars. So finally, coming back to the question that we asked at the start, how confident are you that you can develop or update pathway maps in your system? Interested to know if there's been any sort of change here, if you feel more confident now that we've hopefully given you some useful advice, or potentially less confident given how much work there is to do. So I think that's a positive shift. I think we had a lot more slightly confident or not confident votes at the start of the presentation, which is encouraging. And we'll come back to a QR code and link for the evaluation of this webinar, where you can give us further feedback on what's useful or not so useful.
Thank you, Nick. So we love a word cloud in the IST. So some of you have noticed that we have one on screen. We really value your feedback, as Nick said earlier, on all aspects of this stuff. So if you have things that you found particularly helpful, any particular learning points from today, please do feed into the Menti. We find it really helpful in terms of thinking about how we're going to structure the rest of our webinars. If anybody has any other points that they wish to come in on, or any other questions for the team in parallel to that, please do raise a hand and I will endeavour to bring you in. If not, then we will move on in a moment. No further comments. Okay. Then, despite the continually reorganizing word cloud, which is slightly hypnotic, can we have the next slide, please, Louise? So we, in addition to our Menti things that we will collate and put into the slide deck that we send out to you afterwards, we also really value your feedback on specific aspects of the delivery, which you can do in anonymous form via the evaluation form that is linked to via this QR code. Please do share it share your feedback with us. We do read it all, and we do act on everything that is within our gift to do so. There'll also be a link posted in the Teams Q&A. I don't think anyone can see the Teams Q&A, can you? So I'll send it out in the email afterwards. But yeah, if you could please utilize this QR code, we'd be ever so grateful. Could I have the next slide, please? Okay, and so on to the additional support that we've got to provide to people on this. For those who haven't seen any of these webinars before, this is a new way of working for us. We have put together this program with a universal offer of support. So previously we would only really be able to work with organisations who were in significant difficulty with delivering a specific aspect of a specific agenda, whereas we have put together this program of national webinars for everybody, and we are providing bespoke advice and guidance to any systems that want to use this, and it's free, and you can just contact us via our email or via the Future NHS platform, and we will talk to you about what it is that you need and how we can help you. We do various other things as well. We do some support. We still do some support for very challenged systems who are in sort of SOF 3, SOF 4, and we do support to regional teams to help them build their improvement capacity. And we're working with our colleagues in the model health system around developing their metrics on quality and unwarranted variation issues to try and provide some better oversight at system level of some of those things using the nationally reported data. Can I have the next slide, please? If you did want to work with us on delivering any of these tools, we don't ask very much, but obviously we would ask that you prepare to. There's no real kind of prioritization criteria or sort of exclusion criteria, but we do just ask that you'd be willing to do the work, and the sorts of things that we'd want to do with you are meeting up with your SROs, identifying your support needs, working through what the governance is going to look like and what the priorities we're going to be working on are, and how we're going to work with you. What meetings are we going to come to? What's the scope of a challenge that you would like from us? How frequently do you want us to happen? We'd want a formal kind of commitment between the two of us about how we were going to work, and there would need to be leadership resource allocated to support the delivery of the work in your area. So I'd like to make a plug at this point, if I may, and bring in my colleague Deb from the Making Data Count team around the additional training offers that they provide, which will support you in some of the things that we've talked about today.
Brilliant. Thank you, Simon. Can everyone hear me? Am I good? Perfect. So yeah, thanks for the opportunity. Thanks, Simon, and thanks to the rest of the team. So Simon and I had a conversation last week, and it was the first time that we'd met each other, and lots of linkages between the work. So Simon offered that I could come and talk to you about our offer. So just briefly, who are we? The Making Data Count team. Well, we're a small team of people that work in NHS England, and we're part of the wider intensive support for challenged systems team. And predominantly, we support trusts and now systems who are in segment 4, special measures, SOF 4, whatever you know it as. But as well as providing that intensive support, we have a generic training offer that anyone in the NHS or public sector can access. And essentially, we teach the basics of statistical process control charts and how it can improve your understanding of data and improve decision making. So step 3 is at 1 o'clock today. If anybody's not busy at 1 o'clock today, we do recommend that you do step 1 before you do any of the others, but otherwise, they're available to do in any order. We have a cycle of training, so that will start again with step 1 after Christmas on the 10th of January, but recordings of all the sessions are available. So steps 1 through to 7 We've recently had the addition of steps 8, 9 and 10, which you can see there. So they will come on board in January. The sessions 1 to 7 are currently CPD accredited with 1 point per session as well. So hope to see some of you on some of those sessions. The detail on what's included in those sessions is in the next slide, so you'll have that in your slide packs when you've got access to that. So that's us. Thank you.
Thank you, Deborah. Could I have the next slide, please? So this is another plug for our colleagues in the National Collaborating Centre for Mental Health, who are running a demand, capacity and flow thing that I will let Amar talk about.
Hello, my name is Amar. I'm a consultant forensic psychiatrist and the Chief Quality Officer at East London Foundation Trust. I'm also the National Improvement Lead for Mental Health with the Royal College of Psychiatrists. And you're obviously coming to this webinar because you've got an interest in learning about demand and capacity management and optimizing flow through your pathway. We know how many mental health services across the country right now are facing challenges with managing demand, whether it's inpatient units struggling to meet the need for admissions to hospital, or it's community-based teams who are seeing more referrals than normal or have a longer waiting list due to what we've been going through over the pandemic. We at the Royal College of Psychiatrists are just about to launch a new national quality improvement programme focused on the topic of demand, capacity and flow. We've previously run other national improvement collaboratives on topics such as restrictive practice, sexual safety, suicide prevention, staff wellbeing, and these have all been well received, lots of participation and engagement from across the country and really impressive results. As an example, the most recent one we ran on staff wellbeing over the last 12 months had 38 teams from across 15 different trusts and organisations across the country. We supported them all closely to apply quality improvement as a systematic method to really understand what mattered to staff and what the team felt they could do to improve well-being and joy in work and reduce burnout. And over the course of the year, we've been able to demonstrate now across all 38 teams an increase in the percentage of people experiencing joy in work and a decrease in burnout, which is really impressive work from the teams considering what we've all been going through over the last year to 18 months. So this new quality improvement program is designed to help teams really think systematically and scientifically about the demand that's coming in, to encourage teams to think creatively about how they can use their resource to increase capacity, remove waste and optimize flow through their pathway. We're offering 18 months of support for teams that want to take part, close coaching support together with bringing teams together so they can learn and share together, the true improvement collaborative that many of you will have been part of in the past. It's a subscription-based collaborative, so for each team there's a £7,000 cost to join, but if a trust wants to send more than one team, then there's a 10% discount on that cost. And that cost is just to make sure we have the resource available to support the coaching of those teams with skilled improvement coaches. So if you'd like to take part, please go to the RC Psych website and search for the Demand, Capacity and Flow Improvement Collaborative. There's a form to fill out and the deadline for teams to take part is the 30th of November. I hope to see you or some of your teams in this important work that we're about to undertake over the next 18 months. Thanks very much.
Thank you. Could I have the next slide, please? So we will be there's sort of two tiers to the support offer that there is around some of this work. We'll working with systems who want to work with us around the delivery of some of these resources. There is also additional subscription-based support from the National Collaborating Centre for Mental Health if people wish to participate in their sort of 18-month program around this. We'll be working with them on the creation and sort of support around that as well. So if you do decide to sign up to that, you'll see us there too. If you want to talk to us about any of the things that you've heard today, to express an interest in any of working with us on any of the tools, or if you have any questions, comments, etc., then please do get in touch with us. You'll have all our contact details here, and we'll ping them out in the slides later. Have the next slide, please. So final plug, please do complete our evaluation form. It takes about 90 seconds, is the average length of time according to Microsoft Forms. So we will, promise we won't bludgeon you with a 8-page evaluation form, and we'd be really grateful for your feedback. Future sessions are running, as I said, the next one's the 6th of December. That's the one around patient flow, so very closely aligned to the pathway management aspects of what you have heard today. And then we'll be running back to the beginning of pathways to do patient tracking, access and commissioning. So please do sign up via the Multiverse NHS England registration platform. You can get the recordings of the past sessions on our Futures platform also, and the YouTube, as we mentioned earlier. So please do share that stuff far and wide, because it's not, the future NHS stuff's behind a firewall of sorts, but the YouTube stuff anybody can access. Next slide, please. And that's it. That's us for today. Thank you very much for joining us. Nick, do you want to have the final word?
Thanks, Simon. Yeah, I'm sorry we didn't get the Q&A function fully working, but hopefully we can continue to interact with you via the Future NHS platform. And please do share any good pathways that you've developed, and we can flag those on to other people who are interested in learning from other people's work. So thank you for coming, and hopefully see some of you on the 6th of December. Have a good day.